Welcome to M Health and Info, your ultimate source for all things health and wellness. Join us as we explore the latest in medical science, debunk health myths, and provide expert insights to empower you on your health and wellness journey. Hit subscribe, ring the bell, and let's explore the world of well-being together. This is M Health and Info, where knowledge meets vitality.
Influenza flu. Influenza, commonly known as the flu, is caused by influenza viruses, primarily types A and B. These viruses belong to the Orthomyxoviridae family and can undergo frequent genetic changes, leading to seasonal outbreaks and occasional pandemics. Symptoms. The symptoms of influenza typically include fever, cough, sore throat, runny or stuffy nose, body aches, fatigue, headache, and chills. While most individuals recover within a week or two, severe complications such as pneumonia can arise, especially in high-risk groups such as the elderly, young children, pregnant women, and individuals with certain underlying health conditions. Treatment. Treatment for influenza focuses on relieving symptoms and preventing complications. Rest, hydration, and over-the-counter pain relievers such as acetaminophen or ibuprofen can help alleviate fever and discomfort. Antiviral medications like oseltamivir, Tamiflu, and zanamivir, Relenza, may be prescribed, particularly for those at high risk of complications or in severe cases. These medications work by inhibiting the replication of the influenza virus. Prevention through vaccination is also essential. Annual influenza vaccination is recommended for everyone 6 months of age and older, as it can significantly reduce the risk of infection and lessen the severity of symptoms if infection occurs. Tuberculosis, TB. Tuberculosis, TB, is caused by Mycobacterium tuberculosis bacteria, which primarily affect the lungs but can also target other organs. TB spreads through the air when an infected individual coughs or sneezes, releasing bacteria-containing droplets that are then inhaled by others. Symptoms. The symptoms of TB can vary depending on the stage of the infection. In latent TB infection, individuals may have no symptoms and are not contagious. However, in active TB disease, symptoms may include a persistent cough, sometimes with blood, chest pain, fatigue, weight loss, fever, and night sweats. Without treatment, TB can be fatal. Treatment. Treatment for TB involves a combination of antibiotics taken for several months to effectively eradicate the bacteria. Commonly used drugs include isoniazid, rifampin, ethambutol, and pyrazinamide. Directly observed therapy, DOT, may be implemented to ensure medication adherence, particularly in cases of drug-resistant TB. In addition to treatment, efforts to control TB include identifying and treating latent TB infections, improving ventilation in crowded settings, and implementing infection control measures to prevent transmission. HIV/AIDS, human immunodeficiency virus, HIV, is the cause of acquired immunodeficiency syndrome, AIDS. HIV attacks the body's immune system, specifically targeting CD4 cells, T cells, which are crucial for fighting infections. Without treatment, HIV can progress to AIDS, a condition characterized by a severely weakened immune system. Symptoms. Early HIV infection may present with flu-like symptoms, such as fever, swollen lymph nodes, sore throat, and fatigue. However, many individuals with HIV are asymptomatic for years. As the disease progresses to AIDS, opportunistic infections and malignancies become more common, leading to symptoms such as weight loss, night sweats, persistent fever, chronic diarrhea, and skin rashes. Treatment. Antiretroviral therapy, ART, is the cornerstone of HIV treatment. ART consists of combinations of antiretroviral drugs that suppress viral replication, reduce HIV-related complications, and prolong life expectancy. When taken consistently and correctly, ART can also prevent transmission of HIV to others. In addition to medication, comprehensive HIV care involves regular monitoring of viral load and CD4 cell count, adherence counseling, management of opportunistic infections, and support for mental and emotional well-being. HIV prevention efforts include promoting safer sex practices, access to HIV testing and counseling, and needle exchange programs for injection drug users. Malaria. Malaria is a life-threatening disease caused by Plasmodium parasites, which are transmitted to humans through the bite of infected female Anopheles mosquitoes. 5 species of Plasmodium can infect humans, with P. falciparum being the most deadly. Symptoms. The symptoms of malaria typically include fever, chills, sweats, headache, nausea, vomiting, and body aches. In severe cases, malaria can lead to complications such as organ failure, cerebral malaria, affecting the brain, severe anemia, and respiratory distress. Treatment. Treatment for malaria depends on factors such as the species of Plasmodium causing the infection and drug resistance patterns in the region. Commonly used anti-malarial medications include chloroquine, artemisinin-based combination therapies, ACTs, mefloquine, and doxycycline. Treatment aims to eliminate the parasites from the bloodstream, relieve symptoms, and prevent further complications. Preventive measures against malaria include the use of insecticide-treated bed nets, indoor residual spraying to control mosquito populations, chemoprophylaxis for travelers to endemic areas, and prompt diagnosis and treatment of infections. Efforts to combat malaria also involve research into new drugs, vaccines, and vector control strategies. Hepatitis B. Cause: hepatitis. B is caused by the hepatitis B virus, HBV, a highly contagious virus transmitted through contact with infected blood or other body fluids. HBV can be spread through sexual contact, sharing needles, childbirth from an infected mother to her baby, and exposure to contaminated blood or needles. Symptoms. In the early stages of hepatitis B infection, individuals may have no symptoms or experience flu-like symptoms such as fatigue, abdominal pain, loss of appetite, nausea, and jaundice, yellowing of the skin and eyes. Chronic hepatitis B infection can lead to serious liver damage, including cirrhosis and liver cancer. Treatment. Treatment for hepatitis B aims to reduce liver inflammation, prevent disease progression, and minimize the risk of complications. Antiviral medications such as tenofovir, entecavir, and interferon alpha can suppress HBV replication and improve liver function. However, not all individuals with hepatitis B require treatment, and management decisions depend on factors such as the presence of liver damage and viral load. Preventive measures against hepatitis B include vaccination, which is highly effective at preventing new infections. Vaccination is recommended for all infants, as well as adults at increased risk of exposure, such as healthcare workers, individuals with multiple sexual partners, and people who inject drugs. Additionally, practicing safe sex, avoiding sharing needles, and using precautions in healthcare settings can help prevent the spread of hepatitis B. Pneumonia. Cause: pneumonia is an inflammatory condition of the lung primarily caused by various infectious agents, including bacteria, e.g. Streptococcus pneumonia, viruses, e.g. influenza, respiratory syncytial virus, and fungi, e.g. Pneumocystis jirovecii. Pneumonia can also develop as a complication of other respiratory conditions or due to aspiration of foreign substances into the lungs. Symptoms. Symptoms of pneumonia often include cough, fever, chills, difficulty breathing, chest pain, fatigue, and sometimes confusion, particularly in older adults. The severity and presentation of symptoms can vary depending on the causative agent, underlying health conditions, and the individual's age. Treatment. Treatment for pneumonia depends on the suspected or identified cause of the infection. Bacterial pneumonia is typically treated with antibiotics, while viral pneumonia may require antiviral medications. Supportive care measures such as rest, adequate hydration, and oxygen therapy may be necessary to alleviate symptoms and support recovery. Preventive measures against pneumonia include vaccination against common bacterial pathogens such as Streptococcus pneumonia and influenza viruses. Good hygiene practices including frequent hand washing, avoiding close contact with sick individuals, and covering coughs and sneezes can also help reduce the risk of respiratory infections like pneumonia. Each of these infectious diseases presents unique challenges in terms of prevention, diagnosis, and treatment. Public health efforts aimed at controlling the spread of these diseases, promoting vaccination, and improving access to healthcare services are essential in reducing the burden of infectious diseases globally.